to I'm a Mom podcast, and I am Jenny Pan. This is a really powerful interview with my therapist, Dr. Pearce. She has a doctor in psychology, and she is also a licensed clinical psychologist and certified in narcissistic abuse treatment, clinical trauma treatment, and has advanced training in perinatal mental health. That is a huge mouthful. I think basically what that means is she's incredibly highly accomplished in her field of work. She has been a wonderful person who has brought me to a place of healing for 6 months in therapy with her. And I ask her questions in this interview. How do you know? How do you know if you're crazy? Because a lot of us feel unlike ourselves. We do feel a little bit crazy after we give birth or even during pregnancy, as I did. So I hope that this interview is useful for everybody. I'm so thankful for her joining us. She is a wonderful wife and a mother of 3 herself. So let's dive straight into it. I also want to note that this interview was done a while ago and I did not have the video recording. It was just audio at that time, so I do not have a video of me and Dr. Pearce. The sound quality was not as good as I would have liked it to be. The audio is a bit choppy. So I really do apologize for that. I will make sure that that doesn't happen again. But it is really good content. So I really encourage you to listen to it and share it with anybody that you know who might be feeling lonely in their motherhood journey, who might be dealing with some mental health issues that she may or may not even know that she has, which was me for a while. So here we go. Dr. Pearce, thank you so much for joining me today on this call. We haven't spoken in a while. And honestly, that's a good thing for me because it means I'm doing okay, that I don't have any major problems I need to come through with. Did you ever suffer yourself from any of these mental health issues that you now treat your patients for?
So, great question. My births went well, and I'm grateful for that. I think looking back that I did experience postpartum depression that I did not recognize at the time. And so, looking back, once I had the advanced training that I received, so even someone in mental health, it's a little bit different, kind of turning that perspective onto yourself and being able to recognize things. So, so I have a lot of just compassion. And I mean, I think some of what we'll talk about today is how to know when you're not doing okay. And I really, really get that it is not easy to know always what's going on with yourself. And so, I mean, I would say yes, but only in retrospect did I kind of realize.
To this very day, and I think this is okay, but also it's just subjective, right? I still sit with my baby in the back of the car, like next to her car seat as my husband is driving. And the root of that comes from like the fear that what if we get into a car accident? I need to protect her and I want to make sure that she lives through whatever damage gets done. Another habit I have is every night, ever since my baby girl was born, I have this habit of checking the temperature of the room because I knew that in my very early postpartum days, I couldn't feel what temperature it was because I was hot and I was cold, all those hormones, all those things. I'm like, 1 minute I'm sweating, 1 minute I'm freezing, and I'm like, I don't know what temperature it is and whether it's comfortable for my baby. So I would always have this habit of having this like digital thermometer like thing next to me. And yeah, it just ranges, right? It's like small things and then really crazy things. Some like common signs. Are there some questions that we could ask ourselves to assess whether like, okay, this is beyond, like I need to go and get help?
Yeah, absolutely. Early on in what you said there, you mentioned the word subjective. And I think that is important to keep in mind. It can be subjective. So we think about duration, frequency, severity. Is it stopping me from being able to do the things that I need to do? That is one big criteria. And so the subjectivity of it, is this distressing enough to me that I'm having a hard time getting past it? Is this taking so much of my time, whether it's in going over and over certain types of thoughts in my mind or engaging in certain patterns of behavior that is taking so much of my time that other things are falling by the wayside. I'm not really able to function for myself or for my baby or for the rest of my family. So there is some subjectivity to it. And I would say if there's any question in your mind, it's okay to reach out and ask somebody, because you're not always, like I said, I didn't recognize in myself when I think that I was going through some things. So I think reaching out for an external reference point can be really helpful, whether that's your partner, and just say, hey, this is how I'm feeling, but I'm wondering from your perspective, like, how do you think I'm doing?
Yeah.
And kind of get a reference point. I think that can be helpful. I'm going to talk a little bit about what can be normal, because there is quite a range of what's normal postpartum. It might not feel normal at the time because, as you said, things have really, really changed in your life as you've become a parent, and it does not feel normal, but there are things that are within the range of normal as a new parent that it might be helpful. I do want to give a little bit of that reference point here. In the days and weeks postpartum, there is a lot of normalcy around feeling exhausted, right? Feeling overwhelmed, even feeling very emotional, kind of down. We call this the baby blues. And I think when women are told it's going to be really hard, you're going to feel really tired, you're going to feel overwhelmed, and you might have the baby blues, then that really does set us up to kind of question our own judgment and go, well, now I really don't know, because I'm exhausted, I'm overwhelmed, I feel sad, little things are setting me off to cry. But I think that's normal, right? And so we can then maybe lose our own footing on being able to tell when it has gone past that. And the other piece, I think sometimes women don't reach out for help. I just wanted to comment on this. I think women sometimes don't reach out for help because a lot of the very thoughts and feelings that happen postpartum can be deeply shame-inducing.
Yes.
Because I think as women, we are sort of socialized and taught, to be able to be all things and do all things and just kind of stretch and accommodate what it is that we need to do. And so a lot of women, myself included, might be reluctant to acknowledge, I think that I'm kind of beyond my ability to cope here. And that can be a difficult thing to A, recognize, and B, acknowledge, and then C, do something about. Especially when you're trying to just keep your head above water, caring for your baby and recover from childbirth.
And on your point about the whole shame thing, I think that's huge, because I think that even for me, when I was going through those thoughts and emotions, I was thinking to myself, oh, I can't tell anybody that, because one, I don't want them to think I'm crazy and that I'm not okay and I'm like a harmful person. Like, oh man, she's crazy. Like, she just needs to do X and Y. And you want to be a competent mom.
But if that's you rewashing and re-sterilizing and saying, you know what, if I don't do it 3 times or 5 times and then dry it in a certain way and then put it in a certain place, if I'm not following these specific steps, then my baby's going to get very sick and die. So we kind of look at the extremity or the intensity of the belief, and then also the steps that are being taken to help you feel that things are going to be okay. And do you get to a point where you think things are going to be okay, or does that worry continue to kind of circulate? So that would be an example, looking at the amount of time and the amount of energy that this area of worry, and that the example I gave has more of the flavor of a postpartum OCD type anxiety. But I think these things, the same questions would apply to general postpartum anxiety. If you are able to notice, how much of my day is this taking, how much of the day am I really struggling with feeling very anxious, very hypervigilant in my body, watching my baby like a hawk, just really not able to kind of rest. It's so important to be able to rest in those days and weeks postpartum and go out and do things. And that's not happening. So, and it can even be normal to feel a sense of disconnect or difficulty bonding with your baby, or feeling connected and bonded with your partner. If that's in the first couple of weeks, that really falls within the range of normal.
Right.
We do still hope that is interspersed with moments of enjoying your baby.
Right.
right? So even if it's like, wow, we're still working on bonding, do I have moments where I can glimpse, a sense of fulfillment or a sense of happiness, or at least a sense of peace and neutrality? And it's not all characterized by feeling very, very sad, very, very, detached. And furthermore, looking at duration, if this goes beyond the first 2 or 3 weeks, then it might make sense to ask, because I think most women would have like a 6-week follow-up.
Yeah.
Their birth provider. So if you're still feeling this way and you feel like I'm really not surfacing very often with feelings
Yeah.
of, hey, I think I can do this. Hey, I'm really enjoying just the smell of my baby, and I'm really enjoying holding my baby. Oh, it's, she's so cute. And, if we're not at least feeling interspersed with those kinds of more positive feelings, then it makes sense to let your provider know at that 6-week visit the interest in taking a shower and cleaning up and refreshing yourself. And you're like, what's the point? Right? That might be a warning sign. We all sometimes choose sleep over the shower.
Yeah. Yeah.
And I would say that is a sound decision, at least part of the time. But looking at that overall picture of your motivation and, yeah, I think you said it well at one point, just am I feeling like I'm losing myself? And if you're feeling that way, then it might be a good idea to just check in with your partner.
And like I really had trouble bonding. And I think it becomes more complicated for patients who have gone through birth trauma like myself. Because once you go through that, then it's like not even 2 or 3 weeks of not bonding. It could be months of not bonding, or it could be, the kind of things that you mentioned. It may have a longer duration or things like that. And it's a mixed bag, right? Everyone is so different, and every woman is just built differently. We have different values, different cultures, and all those kind of things that come into play. And there's so many things. Like one thing I remember also in those very early days, I would fall asleep, and because it's so chaotic and you are like living on very little sleep, you're not eating on a schedule, nothing is on a schedule. It's just pure chaos. I would remember waking up in such a panic and thinking like, oh, where is the baby? And because I couldn't remember where I put her last, or I couldn't remember who had the last shift. Is she in this bassinet, or is she in the living room, or is she on the bed? Like, and my ultimate fear was always that she was on the bed and she would die from sudden infant death syndrome. And so I would always wake up in such a panic, like suddenly during the night, and turn next to me. And even my vision was just, in that high emotion of panic, I would look at my husband who, always like faces the other side. And I would think that that was my baby. And I would like, oh my God, she's been on the bed the whole time. And then I'd reach out to touch. And I would always realize, oh, okay, that's just my husband's back. And then I would turn around and see the bassinet and see the baby in there. And it was just such a wacky time. Like, I think that, first few weeks after birth is such a wacky time. Like, you're really not yourself. And like the benchmark of crazy is different. Like for normal people, non-postpartum versus the postpartum mom, it's like, okay, you guys just cannot use the same bar of crazy because what women are going through postpartum is just so, so different and unique.
Yeah. Yeah. You're making me realize that I haven't really touched on those, like coming back to those intrusive thoughts and that being normal postpartum. Almost every woman experiences some degree of intrusive thoughts postpartum. And I think it's about 50% will experience intrusive thoughts that are really quite alarming. Again, it's never wrong to reach out to somebody for a screening or just a checkpoint to say, hey, is this normal? I don't think you can ever go wrong for your own peace of mind. Subjectivity, birth trauma can happen in the absence of anything that on paper would look problematic or traumatic. So you don't have to have something tragic or dangerous happen during your baby's delivery for you to go away with a sense of trauma and develop symptoms related to trauma. So, you know, sometimes it is because of something that happened medically. You know, there are risk factors. I mean, having birth complications, an unplanned C-section, medical interventions, and NICU stay, these are all things that can definitely increase your chances of experiencing birth trauma. But if you experienced moments of intense fear, powerlessness, a lack of communication between you and your medical team or your support person, a lack of control over what was being done around you or to you or your baby. These are all conditions that could lead you to an experience of trauma.
Right.
So how subjective is that? People could be all around you in the room and not know that you are feeling powerless and alone, and like you've gone somewhere else in your mind just to try to cope with it. So, you know, trauma is far more subjective than objective. And so if you are wondering, did I experience birth trauma? I want to give you some of the warning signs or symptoms that you might experience. And even if you look back and go, well, nothing really happened during my birth, right? Like it was fine, but was it fine for you?
Yeah.
Right? We can really look at that. So trauma is experienced after the fact as like intrusive memories. So the idea of flashbacks or nightmares, it can be dreams, where that memory is just intruding in. And that happens because the way that a trauma memory is stored in your brain is different from a typical memory, and it's stored irrespective of time. And so it really does kind of invade and intrude into the present moment. And it feels like you're right back there, re-experiencing it. And so it'll be like a re-experiencing flashback or nightmares. It will also be like avoiding any possible trigger of that because of how deeply activating that is, right? It's so scary. It's so triggering. And so we try to avoid. So for some moms, that might look like avoiding your baby, not wanting to hold your baby because it reminds you, or if you hear their cry, you try to avoid ever letting your baby cry because it reminds you of part of that experience of the birth. It can be avoiding driving down the road where the hospital is, or avoiding if you really don't want to go to that 6-week follow-up visit because you want to avoid the doctor at all costs. Then that could be a sign that there was something traumatic about the birth. It could be insomnia, just not sleeping well, even if you feel like there's not a clear, I'm having nightmares about this, but if you're not sleeping well, that can be a sign. Feeling numb, like you said about not bonding with your baby, but over a more protracted length of time. You know, we're past that first 2 or 3 weeks and you're still feeling like this is someone else's baby. I don't know who this is and I don't really want to take care of it. I'm going through the motions.
Yeah. I mean, I can't speak to, you know, the many other kind of mental health issues you've touched on, like postpartum anxiety, postpartum depression, postpartum OCD. And I think I've definitely had like elements of each one. But like my primary problem was, you know, this birth trauma incident. And definitely, you know, for me, like, how did I know that I wasn't okay and I definitely needed treatment for this was two things. One was, I just noticed that, you know, after you start showing your baby to people and you connect with your friends, you know, a lot of women will ask you and they asked me like, oh, so tell me how the birth was. Like, did you get a vaginal? Did you do a C-section? And I would kind of freeze, and then I would tell them like logically, like, yeah, this is what happened. I had a vaginal, I didn't have an epidural, blah, blah, blah. And every time I told the story in any level of depth, that night I would not be able to sleep. And I never suffered from insomnia unless I had like the huge exam and it was the night before or something like that. But it was really, really rare. I'm a pretty good sleeper and I have no history of mental health issues. So that was one of the first signs to me that like, that's not okay. And I would just sleep or try to sleep, like lay there thinking about that scenario over and over and over again and being so riled up. And like there was a physical response. I was angry. I was like, oh, like just frustrated and just, that whole the trauma brings about these physical reactions from my body, my muscles, and fear, just kind of unable to get through this gripping fear in my head, in my heart. And the second thing is I had a very, very vivid dream, which I will share with the listeners after our interview ends, just to mind time. And I did share that dream with you in our therapy session. So yeah, I mean, definitely nightmares, dreams.
Yeah. I want to also pick up on what you said about the intense fear that shows up in your body. So if you're noticing this, sometimes what you notice is a disproportionate emotional or physical reaction to something, and you're almost not sure why. Like that can be a sign just to take a little closer look. If you notice that your body, there's a book on trauma called "The Body Keeps the Score," and I would even rephrase that a little bit to say, the body tells the story, and it's wise to listen to that. If you're experiencing that strong, visceral anxiety, gripping fear that you were describing, get curious about that. I wonder why my body is doing that in these kinds of situations. What might I need to take a closer look at?
Like a Caucasian hairdresser who knows how to handle my hair, because my hair is much thicker, much coarser than some of their other clients.
Amazing analogy, because we would not look at all hairdressers being identical in their expertise and specialty of what they do. We would say, does that person know how to do what I'm looking for? The analogy,
and are they willing to as well?
Yes, pregnancy and birth would be not to hand over trust to a provider without just doing a good amount of legwork and asking questions about how they routinely provide care during labor and delivery, and make sure that that's what you want.
Go to. And then let's say, this woman or a number of women have realized on this call that actually, I think I need help. So then it's their very first time reaching out to a therapist or a group of therapists or an online virtual therapy service or something. I mean, like myself, some of us have never been through a therapy session before. And some of us have, I think in society, there could be a really inaccurate story of like, oh, just go find a shrink, go and talk to a therapist. And they say, oh, it's a $250 conversation that you could have with a hairdresser or someone, just anyone, a friend, you just, venting. So my question is, what does an initial therapy session look like, and what can new moms like myself expect who've never had a therapist before?
Yeah. So many thoughts are coming into my mind to respond to what you just said. And I would encourage women to view this similar to what we were just talking about. All therapists are not created equal. There are different styles of therapy, different personalities of therapists, different levels of credentials. And so it is going to vary. And so right at the outset, I want to say, explore a therapist's website and read their bio and get a feel for them. And then you may have a first session with a few therapists or a few sessions with a few therapists before you find the one that's the right fit. And I would really, really encourage you to go until you find the right fit. Speaks a lot to the fit. You're going to know that pretty quickly out of the gate, whether you feel at ease with this person. But that initial session often is a little bit different from a typical therapy session, because it's really not therapy yet. It's an intake that therapist is really trying to get to know you, and we'll have a lot of questions to ask. So it's a lot more structured in that initial therapy session. A lot of questions about your history. They will hopefully ask about how did the birth go, because that will help them know how to help you best, and whether the birth experience was a factor in some of the struggles that you're having.
I remember. And I think it's like, you guys do that to find out and figure out, like, does this person have history that is related to their current, where they are currently, like previous episodes of abuse or neglect or other mental illnesses. So I think it's a very deep session. It's not a conversation you would have openly in a coffee shop with anybody.
No, not at all. It's a lot deeper than that. And, it can feel a little puzzling. Like, why does this therapist need to know all of that information just to help me with my birth trauma? But if you think about, well, it's my job to think about, how have you always related to authority figures in your life? So what was your family of origin experience in your story there, and how were emotions handled or talked about in your family of origin? And I'm listening for different things that will help me know how you experienced your birth around, right? And through traumas that we're paying attention to some certain things where we want to really support and have there be a sense of containment to that trauma, and where we leave you at the end of the conversation is a safe place for you to go back and return to your daily life. That's a very simplified summary, but it can be helpful to talk to a friend, but at the same time, there's maybe some caution to be had where you don't want to deepen a trauma that's already there, or vicariously traumatize your friend because they don't have the training to listen to some of those details without harm coming to them as well.
Exactly. And I guess the last question on that whole thing of like, what does therapy look like? I think a really important question is, well, how can we expect ourselves to emerge after weeks or months or even years of therapy? Like, what does a successful outcome look like?
Yeah. So specific to trauma, a successful outcome looks like being less stuck. We hope to disempower the things that were triggering that strong, visceral panic reaction that we were talking about. We would hope that you have less of that avoidance piece. You are able to navigate your life in a way where you are free, more free than before. And those reminders or triggers are not barriers to you anymore. So another way of thinking about this is kind of making a peace with your story, with your experience. We are definitely not in the business of erasing a memory and acting like it didn't happen. But for a lot of women, it looks like making some kind of meaning of that experience, having a purpose come out of it, or at the very least, we go back in and we meet those traumatized parts of you, offer what they need, first find out what they need, offer that to them. And so there's just a sense of inner alignment that comes to be. And again, more of a freedom in your present life, that those triggers and reminders are not triggering you in the same way, and that you're able to navigate without those being a barrier, something that is stopping you. So that's specific to trauma. How you would know that you're kind of ready to come out of trauma treatments. In fact, this is circling back a little bit to how would you know that you need help. I think all women, all people would benefit from just the practice of checking in with yourself. How am I doing today? Is there anything that I need? Am I feeling out of balance in any way? What might I need?
Yeah. And I think like success also may look so different for different people because everyone has a very different experience and very different histories. And so, I mean, for me, I remember when we were in our very first session or so, I told you what I wanted to look like coming out of how many weeks or months we needed. And I said, I want to be able to sleep like after sharing my birth story. Because that was something, it was like a key performance indicator, like a KPI I had for myself. I'm like, okay, that means I'm like more normal, because what that was of me not being able to talk about my birth and not sleeping, that's not normal. Like, I don't want to be like that.
That's not normal for you. You want to get back to that. So if I'm hearing a lot of anxiety and it's new onset, then I encourage moms to just have their thyroid levels checked. And I give them some specific things to look for. Hearing something that is more concerning and I need to send this person for like immediate consult for medication. So I do think there's a benefit to someone who specializes in demographics and worldview and religion, if that's important to you, because you need someone that you feel you can really let your guard down with them. Have them come along with you on a really personal journey. So for me, I think it's really okay to look for, I really want to work with a woman and I want to work with someone that's of a particular age range because that's where I feel like my trust level would be there. Okay. It's okay to look for those things.
Right. And, for some women out there who are listening who really can't afford therapy, there seems to be a range. And it's a very real range. Like some people charge like $50 an hour, $60 an hour on the Northeast. And of course, depending on where you are, it will vary dramatically. And then some therapists could charge, hundreds and hundreds and hundreds of dollars. Do you know of any resources where they offer like free counseling, free therapy, or pro bono? Is there somewhere that women who just don't have the price point at all can go?
Yeah. So for example, our practice at Grace Behavioral Health, we do offer sliding scale, not entirely pro bono, because we like to see clients like investing something in their work, and there's just like a good energy that comes with knowing that you're investing in your care. But we do sliding scale. We have partnered with churches and other organizations that want to help pay for somebody's therapy that's affiliated with them. And so I'm saying this to say, if you're considering a therapist that looks really like a good fit for you, I don't think it hurts to ask whether they have a sliding scale option or pro bono option or any other payment option available to you, right? It's always worth exploring that, because many of them do. And I would suggest Postpartum Support International is an organization I mentioned earlier. I did my advanced perinatal mental health training through them. Their website is postpartum.net. And they have a directory of providers who have the training and specialization in postpartum perinatal mental health.
Wow, postpartum.net. I had never heard of that before.
Yes.
So
Yes, there you go.
I will summarize everything in the show notes and make sure all the listeners have access to what you mentioned. And here is my very last question. So many questions today, but it's been such a good conversation. What is one encouragement you would like to give moms listening right now, especially those that may have had some kind of mental health issues in their mom journey?
Yeah, I think the parting thought that I want to share with moms who are listening is that whatever you are going through, you are not alone. You are not the only one who has experienced what you are experiencing. I know how deeply isolating it can feel to struggle with anxiety or depression, overwhelm, trauma. I mean, just being awake with your newborn in the middle of the night can feel like you're the only one awake. Everyone else is sleeping. So I just think there's such an isolating component of struggling postpartum. And, your tired, overwhelmed brain wants to tell you that you're alone and you're the only one that has ever had it this hard. So my takeaway again is just, I promise you that other women have walked this road and are walking it now. And there are people who understand. So if you are not okay, it's enough of a first step to just say to one trusted person, I think I might not be okay. Don't stay hidden, because you're really not alone.
So I hope that this was a useful podcast for everybody listening. If you have pregnant friends, if you have friends who are trying, I really do hope that this podcast can reach a lot of people just to help. That's honestly the main thing that I want. And I do have an Instagram account, so please follow on at I'm a Mom Podcast on Instagram. There's also this YouTube channel for those of you watching, and this is also available on Apple and Spotify.